Welcome back to Normalized PTSD. Today we have Dr. Feduccia. She was a researcher for the MAPS organization. If you're not familiar with them, their link will be in the show notes, but it's an organization that's leading the charge in legalizing MDMA assisted therapy, as well as they're researching multiple therapies and the use of psychedelics while doing therapy. It's a really interesting topic. Hope you guys enjoy it. So today I have Dr. Feduccia. Thanks for joining. It's kind of a funny story how we got connected. I would say about 2 months ago, I was just flipping through trying to get some more information on psychedelics and some of the research that's been coming out about it and PTSD. And I reached out to MAPS organization and I requested a chat with Rick, or is it Rich? I think it's Rick, with MAPS, which I didn't realize at the time was leaders in trying to legalize psychedelics for the purpose of, he's the one that came out with, what is it, How to Change Your Mind on Netflix. I believe it was Maps that founded that. So then they put me in contact with you, and I've been reading up on some of your stuff. You're the founder of Psychedelic Support and New Day Project. And thank you for joining. I was hoping you could tell us a little bit about yourself.
Sure. Thanks so much for having me on. I did previously work at MAPS for 5 years on their clinical research program, and I'm a neuropharmacologist by training and started researching MDMA back in 2004. So it's great to be here to share what I know about these emerging treatments for post-traumatic stress disorder and educate your audience about what's happening in this field.
Awesome. Thank you so much. So psychedelics have been around forever. I mean, if we go back to it and, that documentary that I mentioned earlier is a really fun source, kind of condensed version of, or I guess more expounds on each individual psychedelics and their treatments. But it can be dated back to, 3,700 BC. Indigenous cultures have been doing psychedelics in with peyote and stuff like that, peyote, and it kind of like stops abruptly in the 70s. And I was just wondering, that's kind of where I'd like to start, because I know a lot of the people that I've reached out to, including like family back home, are like, hey, so what are some things that you guys would like to know about? And they're like, why is it so demonized? Like, where does that come from?
Yeah, that's right. That there is a really long tradition of psychoactive plants being used for medicinal and ceremonial purposes by indigenous people. This is known for a substance called ayahuasca, which combines two plants, chacruna and the ayahuasca vine, which contains a really powerful hallucinogenic substance called dimethyltryptamine. When these two plants are combined, it allows the activation of this compound to reach the brain. So this plant medicine brew has been used for, could it be almost 10,000 years? No one really knows. For sure, thousands of
Mhm.
years. And to me, that just really blows my mind about the knowledge that indigenous people have from plants and being really connected to their natural environment. This was also the case for, as you mentioned, some cacti contain mescaline, which is also a classical psychedelic substance that can induce visionary states and a heart opening experience. It's been known to be used by the Native American people here in the United States and Mexico for a long tradition. Also, mushrooms, psilocybin containing mushrooms. There's These are found in many different locations around the world. So there's evidence of, for sure, the Aztec using mushrooms as part of their rituals, but also other cultures. There's old pictograms and cave drawings that show mushrooms in a revered way. So it's thought that this could have played a really important part in ancient cultures. So you mentioned, the 1970s. This is when a big milestone happened here in the United States, where these substances were placed on the list of Schedule 1 controlled substances, meaning that they had no known medical benefits and that they have a high potential for abuse. So we know from the research that's coming out right now and anecdotally that psychedelics actually are very safe when taken in a controlled setting with good preparation and good care and intention around who's a good fit for taking a psychedelic substance. But what happened in the 60s was basically the cat got out of the bag and people were using psychedelics. It became associated with the counterculture, the anti-war movement. Richard Nixon cramped down on this very hard with the war on drugs, which essentially stopped all clinical research that had started with the discovery of LSD by Albert Hofmann in 1943. And we can talk a little bit more about this early research, but that's all just to say there is a rich history of psychedelic use from indigenous cultures and then more recently in Western societies.
Right. I believe I even heard Joe Rogan, someone was on there talking about how they tested some old wine containers and it was like psilocybin infused wine. So it showed like even in their religious culture that they would use it in ceremonial fashions too, which I was just like, wow, it's been around for quite some time.
Yeah, it's thought that the ancient Greeks, which I think this is the story you're referring to, ergot fungi, which is common on rye,
Hmm.
can induce psychedelic experiences. And this is actually what LSD is derived from, ergot fungi, fungus. So it's believed that the ancient Roman brew, the kykeon or kykeon, it's
Hmm.
called kykeon, was actually a psychedelic substance in that they were coming together ritualistically, having gatherings with this visionary substance. So the traditions really do date back very, very far in time.
Right. And to touch on some of the earlier studies, like in the 60s and 70s, I believe it was shown that psychedelics were really improving or helping with smoking cessation. It helped significantly with alcoholism. And I took some of the courses that you referenced before we spoke and saw that, again, that research is coming out nowadays to further support that, yes, in fact, it is showing to be really beneficial in those areas for sure.
That's right. There was a flurry of research studies that were conducted in the 1950s and 60s. After the discovery of LSD, Sandoz Pharmaceuticals was looking for what can we do with this compound? Like, what might it be useful for? They sent out LSD to many people around the world, including psychiatrists, researchers. It was quite easy to apply, get the substance sent, and do clinical trials to understand how we might benefit as far as therapeutics are concerned. There was a lot of research on alcohol use disorders for depression, anxiety conditions, all kinds of different avenues of mental health treatments or mental health conditions were being tested with LSD and showing some really, really profound effects. However, the research paradigms back then are
Hmm.
not as controlled as they are now with the rigorous placebo double-blind standards
Right.
that we require to get a medication approved for through the FDA and
Mhm.
out to patients that can use them. But that's all to say that there were, thousands of research publications, lots of anecdotal reports and observational studies done during that time. And they were very confirmatory of this idea that shifting consciousness in ways was very beneficial for addressing some of the underlying causes of a lot of the conditions that we know of today, like addiction disorders,
Right.
PTSD, depression, and things like that.
Okay, awesome. We're definitely going to get into the PTSD aspect of it, as well as some of those other symptoms that I think can be like either correlated or one of the symptoms of PTSD. Uh, First, I'd like to I want to hit on the negative aspects of psychedelics because um, I know that when I talk with certain people about this, like they just shut down, and I'm looking to get past that at least to so someone's a little bit curious of it. So the first thing that I think of, or the first memory of anything related to psychedelics, is the traditional eggs cracking in a cast iron pan. It's like brain on drugs. And then it evolved into, I guess, when I was a young teenager, where they debunked this a bit in that series on Netflix, but it was, ecstasy or MDMA is going to cause holes in your brain, and it'll cause your body to overheat and like those type of things. Can you speak to some of those negatives and maybe I don't know, point us in a direction where we can see that maybe some of that stuff is a bit dramatic, or maybe some of those effects are in like extremely high doses, or maybe those people have preconditions or something of that nature?
Sure. You're right about the anti-drug campaign, the war on drugs. It was highly focused on grouping all drugs together and saying that this could really do damage to humans. But we know that substances have really different ways of working in the body and the brain.
Mm-hmm.
Psychedelics are unique in that mostly they're modulating serotonin systems. MDMA works through dopamine and serotonin, norepinephrine. And some of the negative effects that are reported often relate to the set and the setting. So this refers to the environment where someone takes a psychedelic substance and their mindset going into it. So if someone isn't prepared or is in a, kind of hectic environment like a festival, and they take a substance like psilocybin, it's possible that they could start to feel anxiety or panic, or it could be a really overwhelming experience. So that's an important factor. As you
Mm-hmm.
mentioned, the dose and the frequency of dosing can also impact how likely a negative experience or negative side effects could come up for someone. In clinical research trials, the setting is highly controlled. The clinicians who administer the psychedelic substance are trained to work with the experience and work with the individual to prepare them for what's going to come with the therapeutic intervention, as well as the potential for anxiety to arise, and some tools to work with that. So breathing techniques, understanding that often the anxiety will pass. It's more common, right, when someone's starting to feel the effects of a psychedelic substance.
Mm-hmm.
But if they're not in this supportive environment, then it can potentially start to be overwhelming and what's considered to be maybe like a bad trip.
Right.
So those kind of things can occur, particularly for high doses, uncontrolled settings. Um, if people take multiple substances at once, it's more likely. The other thing you mentioned is important to touch on as well, is that, psychedelics aren't the right fit for every person.
Mm-hmm.
We all have different neurobiology. We all have a different past, or historical past. So when we evaluate people for clinical trials, it's known that, some conditions we just don't have enough information yet to say this can be safely administered. So one example of this is schizophrenia. It's really thought that people with this condition should avoid psychedelics, or even people that have a first degree relative, because
Mm-hmm.
a psychedelic experience could activate delusional thinking or symptoms that are known to be involved with schizophrenia. Another condition is bipolar disorder. It might make the symptoms worse or trigger a manic state. I will add a caveat to that, saying that now that research studies are starting to progress and look at more difficult to treat conditions like schizophrenia and bipolar disorder, that these clinical trials are going to be looking more closely at, is there a safe dose, a safe substance? what's the risk versus the potential benefit. But for now, I'd say it's really recommended that, people be aware of these contraindicated conditions, meaning it's not advisable to take a psychedelic. The other big part is there's some medications that people shouldn't take with psychedelic substances, and it can be dangerous to do so. So one example is MDMA shouldn't be taken with antidepressants that are classified as selective serotonin reuptake inhibitors, that's
Hmm.
SSRIs, or MAO inhibitors, monoamine oxidase inhibitors. Because of how these drugs can work in the body, it's puts someone at risk of having too much serotonin in the body, which can lead to overheating and conditions like that. So that's really important for people to understand if they're thinking about taking a psychedelic, to really be aware of their own medical history and what type of medications they might be on, and how they could impact the psychedelic experience that they're thinking about doing.
In your experience with some of these trials, have you ever seen any of these, like I would say the extreme negatives, like someone has schizophrenia episode, someone maybe losing detached with reality, like post uh treatment or lengthy times, or anyone overheating or anything of that nature?
No, this hasn't been observed in the clinical research trials that are going on. And
Hmm.
again, it's related to their screening the participants to make sure that they're physically healthy, have just the conditions that are under study, like post-traumatic stress disorder or depression. So the safety outcomes have been really good and very safe in these environments. And the
Hmm.
other part is it's known that the drugs are very pure. It's pure MDMA. And this is also a risk for people to know about if they procure MDMA outside of a controlled setting, is there's a real problem with contamination of drug supplies here in the United States. Fentanyl is a really dangerous drug, and it's a white powder that's being mixed into all kinds of different substances that people could
Hmm.
buy on the street, or buy from a friend or something like that. So
Right.
that's another risk factor. And there are drug checking kits, which we do recommend in our free harm reduction course on psychedelic support. We get into a lot of these types of measures that, if you're going to do this, try to do it safely, as safe as possible to minimize risk. And there are procedures to reduce risk, although you'll never be completely risk free, even if you do this in a clinical setting, because all substances have side effects and risk. That goes for medications that you take every day. It's just the common property of substances in general.
I was going to say even vitamins, everything has side effects.
It's
Okay,
true. You
so
can drink too much water.
right, called dry land drowning. So what's that's the negative. Now I want to get into the fun stuff. So, a therapeutic session with a psychedelics. Like, I know that each psychedelic is a little bit unique, but the typical setting for that, what would it be like?
Sure. The setting has been pretty similar, whether we're talking about psilocybin or MDMA.
Right.
This is conducted in a living room like setting. So at a clinic or a hospital, they'll try to make the environment be very warm and inviting. The light will be soft and dim. There'll be a couch, two chairs. These therapy sessions are conducted with a
Hmm.
two team members of therapists or social workers, nurses, doctors, guides. But the idea being that it's a very supportive context. There may be really beautiful art or flowers. The music is an important aspect of the therapeutic process. So the person can put on headphones and listen to music, or it'll be playing in the room. They go through periods of time of putting on eye shades and headphones, going within and having this internal experience, and then coming out and talking and sharing with the therapist or guides.
Okay. What does it take to be, I guess, a therapist or a guide for one of these sessions?
Sure. There's several different training programs that are under development now, being expanded and built upon what's been learned from the research studies. So typically there are about 150 to 200 hours where someone will learn about the pharmacology, safety, what the research shows. And we actually cover a lot of this material in our foundational courses at Psychedelic Support. Anybody can take these courses, but it really is like, part A, you got to understand the drug and its effects. And then the next part of the training is more about skills building. At MAPS, they show a lot of videos from the participant sessions to give some case examples of how this treatment looks in different scenarios that might come up. So if someone is having maybe a really difficult time experiencing anxiety, like a pounding in their chest or shortness of breath, how the therapist might work with someone to make them feel supported and safe. So that's the type of skills that are taught during these training programs. There's also the element of supervision and apprenticeship. So working with someone that's experienced, learning by doing the actual therapy.
Right.
For MAPS trials, which is the Multidisciplinary Association for Psychedelic Studies. And you mentioned Rick Doblin, who founded this organization in 1986 and has been at it for over 30 years, trying to get MDMA-assisted psychotherapy approved for the treatment of post-traumatic stress disorder. So a lot of the methods and the models that I'm talking about have been developed over time with MAPS and a small group of other researchers. And really, the method was based on the work that went on in the 50s and 60s. So it's very similar to what was learned and experimented with back then.
Okay. So one of these sessions, I'm just trying to go broad and then eventually bring it into like each different ones. But is there any addition to like some type of speak therapy while going through the experience? Is that like the general idea?
Yeah, so it really does come down to the substance that's been administered. In the case
Okay.
of MDMA, it's known as an entactogen or an empathogen.
Mm-hmm.
It's different from classical psychedelics in that someone will feel a lot more heart opening. They'll feel maybe more talkative. They'll feel a sense of bonding with the therapists and the therapy teams, a lot
Mm-hmm.
of safety. That otherwise maybe during psychotherapy, whether consciously or unconsciously, we build up defense mechanisms around past traumatic experiences or difficult emotions and memories. So MDMA is really allowing someone to enter this space of feeling safe where they can talk about past traumatic memories. Oftentimes, other details may emerge or a different perspective around what happened. So MDMA is a good catalyst for talking and sharing. And by doing that, the brain is reprocessing these past traumatic events that occurred in somebody's life. It also, which is really, really fascinating about this compound, is childhood trauma that may have been repressed or not, really on the awareness for someone. It's not uncommon for these experiences to suddenly come back to the person that's undergoing MDMA. This can also occur with other substances like psilocybin, LSD, or ketamine. So this is one reason too, why it's super important for someone to work with a therapist if the intention is to work through past traumatic experiences or if they have PTSD. Because if they come up and a person doesn't have the support and someone there to help them kind of work through what's going on, it could become re-traumatizing because it's
Mm-hmm.
essentially exposing the trauma.
Right.
And as a neuropharmacologist, I got really interested in, what's going on in the brain when someone takes MDMA and goes through therapy. So there's a lot of different mechanisms at play, likely, but one could be that the hippocampus, which is highly important for memory formation, memory recall, and the amygdala, which is processes a lot of emotions, becomes highly activated when someone enters a fearful state. But under MDMA, in neuroimaging studies of healthy individuals, it was shown that the amygdala and the hippocampus start to talk more. There's greater communication. And there's less communication with the prefrontal cortex, which is the area of the brain that is our kind of cognitive,
Mm-hmm.
um, thinking part of our brain. And so what's probably happening or possibly happening is that as these memories get recalled, now you have these different neurochemicals and hormones flooding the body from the MDMA. You're in this supportive context with the therapist, and it's possible that the memories are somehow adjusted or rewritten in some way that get filed back in the brain in a way that is no longer triggering to the person.
Right.
It seems that with PTSD, nightmares, flashbacks, this uneasy kind of feeling is because somewhere right under the surface, your brain is saying, be on alert, bad things are coming, be aware, stay
Mm-hmm.
hypervigilant. Or the other aspect is numbing or trying to, that's a common experience as well for PTSD of not being able to access emotions fully. So MDMA could be really opening this window of arousal, a window to reassess and process these memories throughout like all day sessions with MDMA. And perhaps we think this is how it's working to really reorganize those thought patterns, reorganize those memories so that a person can then kind of move on in their life from those past experiences.
Okay. Do you think it might have, I don't know, I was curious about the MDMA one, with the extra serotonin and maybe just that euphoric feeling may desensitize some of the pain associated with those historic memories, so it's easier to process and maybe might make it a little bit easier to like evaluate it and almost feel a bit detached from all the negativity of that moment.
That's right. Yeah, there could be feelings of more acceptance or love for
Hmm.
oneself, forgiveness to, maybe something maybe you did or someone close to you did that was painful and associated with, like some memories that are holding you back or causing symptoms of PTSD. There are also what we call integrative sessions that follow the MDMA sessions.
Hmm.
And these are really important because it allows someone after the experience when they're back into their normal state of consciousness to further talk about what came up, process further, and really set out some pathway for recovery. If that could look different for everyone, right? There might
Right.
be some behavioral adaptations that they want to work on, maybe aspects of relationships with their partners. Maybe it's about sending a letter of forgiveness to someone that caused harm in the past. It's really up to the person in their own personal journey with recovery. But nonetheless, the therapy is thought to be really important for recovery from post-traumatic stress disorder with MDMA. And that's why
Right.
it's called MDMA assisted therapy. We
Hmm.
don't see people just spontaneously recovering from these mental health conditions from taking MDMA.
Right.
It might be helpful, if you have a friend there, but I don't know, it's like
Right.
if you go to a party, you take some MDMA, I wouldn't expect that all of a sudden your, trauma has been worked through and it just disappears. So it's about this using the drug to catalyze the psychotherapeutic process.
Right. That was one of the, I have a comment that I was writing down. Psychedelics aren't a magic pill. I read that while I was reading up on this, and it's like, in addition to the therapy and doing them together is where the huge results are coming from.
That's right. So I could speak a little to the results in MAPS phase 3 study, which is the first and only phase 3 study to date. No other substances, psychedelic substances, have made it this far. And what they found was that 67% of the participants who received MDMA no longer had a diagnosis of PTSD 2 months after treatment. And so the treatment included 3 MDMA sessions, 3 preparatory sessions, and then 3 integrative sessions after each MDMA session. A lot of sessions there.
Right. I was wondering if you could break that down just a little bit.
Yeah, but I'll just say, 67% the MDMA group compared to 32% in the placebo group, who also had the same number of therapy sessions, but instead of MDMA, they were given a placebo.
Okay.
To break that down a little bit, the preparatory sessions are about 90 minutes long. It's with the co-therapy team. It's really to, build rapport, help the therapist and the participant get to know each other, know more about the personal history of the patient, and prepare them for what the MDMA experience could look like. When someone comes in for the MDMA session, they start in the morning, they check in with the therapist, and then the session will go for 6 to 8 hours long. And it is thought that this long time period is important for just a lot of different things to come up and different aspects of the therapy to really play out. And then after, the person will stay overnight in the clinic with a night attendant. There are some studies that are starting to send people home with a trusted family member or friend. And then the next day is the first integration session, which is about 90 minutes long. And then they'll do 2 more of these integration sessions over the course of a month. Then the next MDMA session, and then 3 more integrative sessions, and it proceeds like that.
Okay. And the integrative sessions, there's no MDMA, correct?
That's right.
Okay.
So there's no MDMA during those sessions. And it's really about, talking about what came up during those sessions, maybe setting some intentions for the next sessions, thinking about, strategizing about, all right, now how do we put this into play in your life to, like we said, maybe improve relationships or quality of life in other ways.
Okay. So something I was reading and I found pretty cool is psychedelics really impact like a lot of areas. There's substance abuse, smoking, PTSD, anxiety, depression. And I was wondering if you could just kind of speak to that. Like something that I saw written was, a lot of those are symptoms of a root cause problem,
That's right. Yeah, okay. I believe that too. Often it probably is trauma. Gabor Mate talks a lot about this. And, of course, there's a different spectrum of the severity of traumatic experiences someone could have. But often, probably what is driving addiction behaviors or PTSD or anxiety is some traumatic experience that happened to someone. The other aspect is, being a neuropharmacologist, I do believe that some individuals just get dealt a bad hand of genetics, and perhaps there's less serotonin or dopamine in the brain, or these circuits work differently, which is why, some medications can be hugely helpful for some individuals, while for others, they just don't work so well.
Right. Okay. The next one was, so this seems to be like another umbrella of therapeutic practice, so there's cognitive behavior therapies, there's somatic experiencing, like there's all these different avenues to seek help if you're looking for help. And this looks to be like a new one. What if I was to name that umbrella, what would it be called that would cover all these different, I guess, psychedelic therapeutic practices?
Yeah, so it's a novel approach because it's combining therapy with a drug or medication if it becomes approved. As you mentioned, with post-traumatic stress disorder, there are 2 FDA-approved medications, which are both antidepressant antidepressants,
Hmm.
SSRIs, Zoloft and Paxil. There's a number of different types of therapies that are available, such as prolonged exposure, cognitive behavioral therapy, EMDR, psychotherapy. The idea with MDMA is that it's being combined with a very broad sense of psychotherapy.
Hmm.
So therapists can actually bring different modalities to this, but the main premise is to follow the inner healing intelligence. And what this speaks to is that someone really has the ability to sort of self-direct and guide their own healing. And MDMA really opens up the mind um, to this premise of allowing these memories to come up, or really knowing internally what to focus on. And a really good metaphor for this is like if you go to a doctor because you slashed your arm on a piece of glass, the doctor can set all the conditions, clean the wound, stitch it up, put some ointment and a bandage on it. But the body is going to do the work to actually repair these skin cells and heal the wound. You can think of
Hmm.
it similar with a psychological wound. Everything can be set into place, and then the body and your psyche is going to know what to do to actually come back to homeostasis and come back to a sense of healing and wholeness from the traumatic experiences that were experienced.
Okay. So, I mean, that's an interesting topic. Like, so they're applying this, and I say this, it seems like MDMA is the winner so far. Would you do you have any more to touch on with, like, say, psilocybin, ketamine, any of those? Like, are those showing other avenues of, like, DMT I saw, which I guess DMT is just another word for MDMA. But can you speak to some of the other, I
Well,
guess,
DMT is
psychedelics?
actually quite different from MDMA. It's
Perfect.
a classical psychedelic, and
Yep.
depending on how you ingest it, DMT can be smoked, and that's a very quick psychoactive experience that people can have very strong visionary states. It's over in about 15 minutes. DMT is also the active constituent in ayahuasca, which
Mhm.
also contains MAO inhibitors. So when DMT and MAO inhibitors are consumed together, it makes it orally activated, and the time course is much longer. So ayahuasca could last for about 6 hours.
Oh, wow.
There are anecdotal reports about people taking ayahuasca and really being able to, experience healing from PTSD and trauma. One caveat there is we did do a survey. It's not published yet, from individuals that had gone to Peru or Costa Rica and had PTSD or these type of symptoms. It was helpful for some people, and for other people, it just brought up the traumatic memories in a really vivid way,
Right.
uh, and perceived as really challenging, harmful.
Hmm.
They just felt just and didn't feel that it was helpful for their symptoms, and really just made it worse. So that speaks to really needing more research,
Right.
more preparation, control, integration to work with some of these cases that we really want to make sure that the risks are minimized. Ketamine, there are some studies for PTSD. I've also heard similar things, as I just mentioned, um, with with PTSD, is that if not well supported, it can be re-traumatizing.
Right.
The other one you mentioned, psilocybin, there are some early stage research programs going on now
Hmm.
with psilocybin. It does work differently in that there can be a lot more visual or auditory effects from psilocybin. It really depends on the dose. People may have old memories come up, or it might be just a lot of metaphors, and the brain sort of processing different things, but not so much in the verbal way, or like a timeline of experiences, which seems more common with MDMA. So it might be that the mystical type experiences that come from psilocybin can be healing in different ways, and that the therapy and support after can then help the person sort of look at their life and look at how to move forward, or have different insights and motivations from the psychedelic experience from psilocybin.
Okay.
But we still need, to really look at the data that comes from those trials, and see what might be the best approach for each individual.
Okay. I read a lot about ego. It seems like each one of these, there's some sort of comment about address ego or death of ego. Like, what does that really mean?
Right. So the ego dissolution
Yes,
is
ma'am.
what they call it, or ego death. This becomes more prominent with classical psychedelics like psilocybin, LSD, DMT, and or 5-MeO-DMT, which is another compound that's derived from a toad species in the Sonoran Desert. But anyhow, the feeling of ego dissolution is like this loss of the sense of yourself. So all the things that make you you,
Mhm.
your thoughts, your orientation, the time and place of where you are. So that can start to fall away, and you may find yourself in what feels like, a different place, or you're no longer attached to your personal history or your orientation in the world. This can be very terrifying for some people. It can also be extremely healing too, to come back into the body and come back into the sense of self. And what happens is often there's this great appreciation for one's life and
Mhm.
for this person that you are, and the gifts that all of us have innately.
Right. Um, have you ever tried psychedelics? I'm curious.
I have, yeah.
Yeah. I was
I
wondering,
grew
is
up.
that like a prerequisite or is this like from younger years? Like what led you there?
Sure, it's been, an evolving journey for me, really. When I was 15 years old, I was growing up in Louisiana. And as you mentioned, the drug education in the past was really related to, this stuff's going to fry your brain, don't do it. And of course, being a teenager, my friends and I wanted to try psychedelics because we had read all about like the Beat Generation, the poets, the music that came out of the 60s. We watched Dazed and Confused, and we're like, we got to get our hands on some of this because our parents obviously are holding back on telling
Right.
us what's up because it must be that great. And so we took some LSD and went to a Catholic high school dance. And it was really fun. We're dancing around, everything's blinky. And I took another hit of LSD and we left. And it just really went sideways for me. I had the ego dissolution experience while riding in the back of a Jeep, where I just left my body and I went through this journey of seeing like basically every memory I ever had in my life.
Hmm.
And that then extended into sort of other lifetimes and other events in the world. And it was like I was just on this journey, but my body was acting out in other ways. And so ended up getting brought to the hospital. My friends were really concerned because they weren't having that experience. And I woke up with my parents there at my side, and I had what's known as like sort of this classical rebirth experience where I came back from this journey, came back to my body. I didn't want to. I remember that experience of like, I didn't want to leave this peaceful beach I had finally arrived at.
Hmm.
And I experienced, yeah, this coming back into myself. And it was, really strange and confusing experience for me. The next day, there was no integration. It was my parents being very concerned, very upset that I'd taken LSD. As you can imagine, having your
Right.
15-year-old daughter, being picked up at the hospital for a psychedelic experience was very concerning to them. But I had this also just spiritual awakening from this whole psychedelic trip that had gone sideways for me, but I didn't have anybody to talk to, and it was frightening and liberating all at the same time. So I'd kind of just sort of stuffed that down for many years. And I wanted to understand, like, how could this tiny drop of a substance change my whole sense of consciousness in that way? And so I
Hmm.
started studying neurobiology. I got a degree in neuropharmacology. And, back then at that time, I was just visiting the library in Baton Rouge, trying to make sense of it. And I felt like I had a near-death experience. That was like the closest thing I could come to of like what had happened to me.
Hmm.
Um, so it just really set me off on this path of wanting to understand how all this works in the brain, and if you could activate it with a compound, can you activate it without a compound? And I believe that is true. Like meditation, different types of breathing techniques, other aspects of shifting consciousness, I think can help us to reach these states. But for sure, psychedelics do something in our brains to induce these experiences in a big way. And so, yeah, through the years, I've always treated these medicines with a lot of respect and intention, and become very knowledgeable about each substance, and really ask myself, why do I want to do this? Is this right for me? What do I hope to gain from this experience? And I feel like that type of respect for just how powerful and potent these compounds are is really important for anybody that's thinking about taking a journey or exploring with psychedelics.
Right. Do your parents have different thoughts now that you have a PhD and you've done so much research and impacted so many people's lives in a positive way?
Yeah, after I started working at MAPS in 2015, I left the National Institutes of Health, had finished a postdoc there. And at first they thought I was crazy, like, oh, you're gonna go work at this tiny nonprofit,
Right.
this fringe drug, and like, what are you doing with your life? But they've always been quite supportive of whatever made sense to me and what I
Hmm.
wanted to pursue. And they started learning more. And I invited them to a dinner we hosted in New Orleans, which was a psychedelic dinner series to help educate people and talk about what they know about psychedelics, what their fears are, what do we have to learn. And there we showed a video of a veteran that had gone through the MDMA assisted therapy trial for PTSD. And my father is a veteran, so is his father, and he had been in World War II,
Hmm.
right there on the front lines, and had what we know now was PTSD his whole life, which was a difficult experience for my dad to grow up through with
Yeah.
him. And so seeing this veteran really start to talk about what had happened at war, internalized shame and pain he felt around the things that he had done, and the way MDMA was just allowing him to sort of articulate that, but also this awareness of like, yes, that happened, but who I truly am, I am, still a good person,
Right.
and I do still have love and valuable aspects of myself and acceptance around what happened there in a way forward. And that veteran got a lot better on his PTSD after going through the treatments. So my father really started to understand more that, yeah, this wasn't just about, taking a drug to feel high and feel good for this
Right.
experience, but it was about really getting at that underlying driving point parts of what's keeping those experiences alive in someone, and not allowing them to really fully integrate into their life.
Right. There's two other things that I saw psychedelics helping with, and I just wanted to know if you had any experience with it, which one's TBI and the other one's tinnitus.
Yeah, so this was very experimental. There has been shown that several different psychedelic compounds in cell assays and animal models can actually induce neurogenesis, which is the growth and repair of neurons in the
Hmm.
brain. And this is the basis of neuroplasticity, which is how we learn things. It's how new connections are formed in the brain to ingrain new behaviors or new thought patterns. So this is really fascinating research that's going on now for traumatic brain injury and tinnitus, because it could be part of the mechanisms of why people are reporting that they feel better after taking psychedelic compounds, or microdosing psychedelic compounds, which is taking a very small dose. We're not really having these big consciousness shifts, but perhaps you are getting some sort of benefit, whether it's neuroplasticity or tuning the serotonin system in some way. The research is still very early, but it's great that it's actually being conducted now so we can learn more.
Right. A bit about my history. I was former EOD in the United States Air Force. So if anything can take that ringing out of my ears, sign me up.
Yeah, there is some, early research with MDMA showing that.
Right. That's what I
And
was reading. Highlighted it. I was like, we're going to come back to this.
so yeah, I mean, possibly it's also interesting too with headache disorders like chronic headache conditions.
Hmm.
They are finding that psilocybin, like lower doses, are being really, really effective for cluster headaches, migraine headaches. And it's interesting because there are medications that are already approved for headache disorders that are derived from ergot fungi,
Hmm.
which we talked about, as that's where
Right.
LSD comes from as well. So people that have had these conditions that haven't been responding to medications available are having way less frequent headaches, less intensity, in longer periods where they don't have these episodes of headaches. So this research is being conducted at NYU, and it's really exciting because that's a totally different mechanism than what we talked about with like using psychedelics to process psychotherapeutically. It really
Right.
seems to be related to how it's activating the brain and receptors in the brain.
And I saw that on your website also about microdosing. And I don't think we've really hit on it. And I was wondering if you could just kind of.
Sure. So this got really trendy this past decade after Jim Fadiman published the book Psychedelic Explorer's Guide. And here he's talking about taking a psychedelic substance that's about 5 to 10% of what we'd call like a full dose.
Hmm.
Idea being that you're not having visuals, you're not really feeling like you're altered, but you're having a very small shift in your perceptions and how you're feeling. So his protocol was that you would take a microdose for one day, and then 2 days off, and then take a microdose, and then discontinue after a month. And the spacing there was about like not having tolerance to the effect. So once you take something over and over, you might relate to like caffeine and coffee, then it's just not as strong as it was before. So what people are reporting, most of it is we call anecdotal, hasn't been tested in placebo-controlled studies, just starting to get into that research. But all
Hmm.
kinds of positive benefits people report, like improved mood, less depression, greater creativity and focus, more motivation. Some say it's really helpful for tapering off antidepressants. And where it may not be so helpful is anxiety. People have anxiety conditions, might actually make anxiety a little worse.
Right.
But all this is to say that it's probably different for everyone. It's
Hmm.
also possible that there's a placebo effect, taking something and confirming that this confirmational
Right.
bias that you heard and you've read
You
all
want
this
it to
stuff how
work.
cool it is. But to me, I was like, if it helps you, it helps you. Like if it's a
Right.
placebo effect, that is a real effect, well documented. And if you can reliably create that's wonderful.
And that was one thing I saw about Ibogaine. It was showing really good benefits with opioid addiction withdrawals and things of that nature too.
Yeah, that's right. And ibogaine has actually binds to opioid receptors in the brain. which is why it's thought it's particularly helpful for the withdrawal process.
Oh,
But it
wow.
also has some very serious side effects, like people have died from ibogaine
Right.
because if it's combined with certain medications, including opioid drugs, or if someone's heart is preconditioned or they have heart disease, then it can be fatal. So it's extremely important that people understand, like, all
Oh, good.
psychedelics
Yeah.
aren't created equally. There's different risk.
Yep.
And if you're going to go do ibogaine, there are clinics in Mexico to really do your research and find clinics that do medical evaluations, have EKGs on site, have resuscitation on site, talk to you about medication tapering. All of these points are very important for safety with ibogaine. And it's just now
Right.
starting to be researched, but it does seem to be extremely helpful. And given that, opioid addictions are super difficult to treat,
Mhm.
that having new options, we really need to find that. We really need to find things that can help people get off the drugs and then stay clean long term.
Right. Yeah. It's really impacting at least my community pretty powerfully in a negative way. And it's nice that there's things that are like counteracting that. So I have 5 questions to basically just conceptualize everything to make sure, because these are like the 5 that I think I got from everybody. And I just want to make sure that I do answer these. So is it legal and safe to try psychedelic therapy? And if so, where do you go?
Sure. I would say, you're going to have, it's more safe if you're in a controlled setting with trained clinicians. Typically, right now in the United States, these substances are still illegal. So the way to access that is by joining clinical trials. Ketamine is available and prescribed off label. You can go to Psychedelic Support and find clinicians that offer ketamine assisted psychotherapy. We also have a list of all the clinical trials going on right now.
Mhm.
There are legal options in Mexico, Peru, Costa Rica. But again, that you want to be, go with a friend and make sure you really understand what that is all about, because traveling to a foreign country and having this intense experience might not be the best choice for everybody. I think the most dangerous thing right now is the fact that psychedelics remain illegal. There are some states and cities that have started to decriminalize psychedelic substances, but nonetheless, you are at risk for potentially being arrested and facing legal consequences.
Right. And I will add in the show notes as well as some of the social media post links to the courses that you provided, which are good sources for becoming more educated on the topic, as well as it hits on some of the places that it is legal or not legal, decriminalized, as well as outside the United States where it is legal. Let's see. How long are the effects, and usually how many treatments does it take? I think we hit on it for MDMA. It's 9 and then 2 sessions of MDMA, but then I was just wondering if you could just summarize that again.
Sure. Yeah. Generally, it's like 2 to 3 sessions with MDMA and then all the integrative visits
Right.
and clinical trials with psilocybin and similar dosing. With the terms of the effects, like, that's what's been so phenomenal about the MDMA trials is they measured people a year following treatment and found that 67% of the participants didn't meet PTSD criteria,
Hmm.
which is showing a really long-term improvement. And a lot of people even said that their quality of life improved further as their PTSD symptoms were resolved. They were really finding more joy in life, and the relationships were improving. They were able to get jobs, or job satisfaction improved. So the effects can be quite long.
Hmm.
And also want to reiterate, though, that there's still a third of people where maybe there's some benefit, but it just didn't really work for them. And so
Right.
it's not a cure-all. It might not have the long-term effects. It might get people to a better place, but maybe not fully recovered. It's a lot of work, a lot of hard work, and it's not, just a drug doing magic. It's also the person as well participating fully in the recovery process.
Right. These clinical trials, The only thing I think that has a worse stigma than PTSD is psychedelics. Can you do those anonymously, or is that not available? Because I had friends specifically ask that question because they may be in a federal position, and one, if they had, say that they have PTSD, they're found unfit for duty. Not only that they're trying psychedelics to get over PTSD. So I was just curious if there's an avenue to get help, but get help anonymously.
Yeah, so when you join a clinical trial, it's confidential. It's
Hmm.
covered by the HIPAA Privacy Act, which is similar for when you go to a medical provider. There are now studies starting up within the VA. One is at the Bronx VA with Rachel Yehuda, who's a really well-known PTSD researcher, and they're going to be enrolling veterans specifically. So I think in the coming year or two, we're going to start seeing a lot more um, trials specifically for veterans or active duty military professionals.
Hmm.
Um, but yeah, nonetheless, like you're saying, they are still scheduling substances.
Right.
I'm sure active military folks get drug tested randomly. So just really being aware of, the risk of and how it might relate to your own personal situation. But I think, once it becomes FDA approved, we're anticipating MDMA that could happen in late 2023
Hmm.
and start to be available in clinics in 2024. Then that worry could really start to ease for military professionals, if that's a right path of treatment for them.
Okay. Awesome. And that's everything I wanted to hit on. Is there anything, I guess, that you would like to discuss that maybe we didn't talk about yet?
Well, I think we covered a lot, and just tell everybody to stay tuned. And as you mentioned, the Netflix documentary with Michael Pollan is based on his book How to Change Your Mind.
Hmm.
Has some great information. So the book or the Netflix show is super interesting to watch and a good resource to share to those that might be skeptical or want to know more and curious about what's going on. So thanks for listening,
Yeah.
and do check out our sites. Psychedelic.support is the URL. And then Project New Day is a nonprofit I work with that's for using psychedelic treatments for addiction recovery.
That's amazing. Yeah, I was going to ask next, how do we get in contact with you and help you further your adventure too? I really appreciate everything that you do, and I love the new research that's coming out. It may not be the magic pill that I feel like it's kind of getting glorified as, but it's definitely a really good tool in the toolbox that may help if the other ones don't. And yeah, boom, with that, we're going to wrap it up. Thanks so much for your time. It was awesome. Very informative. And with that, we're going to wrap things up. I hope everybody enjoyed that. If you have any questions, DM me. I'm on all social media platforms. Really appreciate the share and the follow. Thanks so much. Chat soon.